All right, we're here today with Cal Dietz. It's a real treat having him here today. He's been showing us all kinds of stuff all morning long. He's been blowing our minds with his knowledge. It's been absolutely outstanding. Our boy Andrew, as many of you know, has had back issues for a really long time. Cal's going to help him solve some problems, so here we go.
So we're going to take a look at Andrew, and we're going to see, first thing, we got to fix your chest breathing. It makes things kind of tight down here. Okay, so you chest breathe a lot. I need you to really focus on your belly. So I want your belly breath going deep into my hands. In and out, very good. Just push into my hands. And that's where I'm going to need you to focus. So I'm going to check a psoas, strength levels. Ready? Hold. You have any? Can you hold it?
Oh.
All right, there's not much there. Do you feel that?
Yeah.
Ready?
Yes, I might.
Okay, so grit your jaw nice and hard. Now relax it. Go la 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 la.
La 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 la.
So he's got nothing. So he cheats with his jaw. He'll find stability with his jaw. This is a
Is that why we wince and stuff sometimes?
Yes.
Is that what we're doing?
Yep, and that's so what we want you to do is be able to be strong without doing that, and then that takes away compensation. So that's more or less level 2 RPR. Okay, so your psoas definitely is not working. Where's your back hurt?
Right there.
Right there? Okay.
More on the left, my left side, but
Okay.
right there, yeah.
So, and then one of the things is that I like to see about 4 fingers between your bottom rib and your hip bone. He only has about 2, maybe 2. So this thing's all getting collapsed down.
So he's kind of everything all stacked up.
Stacked up. So I need you to work on your breathing. Very good. Basically, I want you to breathe while I go over your breathing here. Okay.
A lot of what you're showing him, he's going to be able to do himself too, right?
You can do this. You're going to do this all yourself on a daily basis. Did you do RPR before?
No.
No, you didn't.
No.
Okay. Let's show you RPR
Okay.
on your own, and maybe every day you can learn it. Maybe this will help. Let's see if we can make it better. Yeah. Is there a position that hurts, or does it hurt all the time?
Right there. Laying down flat on my back or on my stomach.
All right.
Just killer.
Okay.
Yeah.
Did you ever hurt your back in any particular way, or just hurt for a long time?
Well, I had the awesome opportunity of sitting for like 12 years straight with my job.
Is that all?
Yeah, I know, right?
Were you in jail?
Kind of.
Kind of.
And then it wasn't until actually I was squatting one day, and I tried to squat a little bit too much, and when I hinged the weight off my back, it ruined everything.
Okay.
The doctor wanted surgery like immediately the first day I went to go see them, and I ran out of there, and they said it was a herniated disc. I kind of gave up on everything. Mark helped me. He got me moving again.
Yeah.
And then I've been better.
Right.
But he has to always pay attention to it.
Sure.
Always. Correct. Yeah.
So hopefully we can get the right patterns in place. So what I want you to do is I want you to go down the middle of your ribs. We're going to do the RPR breathing. So I just want you to put your thumb in that position, and you're going to go through there, and you're going to push. Okay, move your skin a little bit. You're not going to rub up and down. You're just going to grab your skin. You're going to go about probably 1 inch movement back and forth all the way down your chest, just like I am. I want you to go down the middle. So this is the start of the breathing. Yep.
As I'm breathing.
Just like I was. Just kind of where you're pushing back. Now I want you to work on your breathing the whole time you're doing this. Breathe. Breathe. Yep. Move on. Now once you get down to the sternum, then I want you to go on the edge of your ribs, like right here, underneath them, just like that. You feel that? Is that pretty tight in there? Yep. So if they're tight in here, they always have a C-spine that's locked up tight. There seems to be like a band that runs there across, okay?
Right.
So
It's like a popping or something going on this side.
there is a popping, okay? So what I want you to do is follow that rib all the way down for about 3 inches, okay? So, yep, just right there. Keep your breathing going. Just on the edge of that rib, yep. Sometimes it's easier to go on the...
Kind of gross.
Like with the opposite?
Okay.
Yeah,
because I'm all...
Yeah.
Okay.
Keep breathing. Good.
Just keep following down.
Yep. Go all the way down. And keep your breathing going. Do both sides.
I'm getting jealous. So I had to do it myself.
Yeah. Keep breathing. Really work on this breathing right here. Push your belly. There you go. Okay. Now, the next thing is the psoas. So we're going to go for your belly button, over an inch, down an inch. And we're going to go right in there. And you're going to push in. Right there. Breathe. Maybe bend over a little bit to loosen that tissue up. Yeah. Here it is. You feel that?
So I've been told that my psoas is terrible, and I can never find exactly where it is. So you said it's 2 inches.
And we're not trying to find the psoas. We're trying to find the spot that activates the psoas. So we're not getting the psoas.
Got it. Okay.
Yeah. So we're just hitting spots that activate the muscles. We're not worried about getting to the psoas.
He was also pointing out earlier that sometimes if you kind of bend down a little bit, it'll relax and you can dig in there a little bit.
You feel that? All right.
And work on your breathing still.
Let's hit the other side. Yeah. Over. Yeah, right there. You got it. Okay, so hit a few breaths. All right. Now I want you to go right behind here. You feel that spot?
Oh my God, yeah.
Yep, and you're just gonna pull forward, so it's right behind the jawbone, and I'm not using too much.
Are you sure?
Yep, I'm positive, really.
Holy.
Yeah. Yep, and you hit it yourself right there.
Oh my God.
Yep, breathe.
Does it feel like that for everybody?
It'll get better. Breathe.
Some of this weird stuff, but like honestly, this could be like
This jaw, your right side, is tied to your left glute. It's opposite. The back of the skull is actually the same side, but the glute. So if you know your glute's not working, so if your right glute's not working, it's this side and then this jaw for the right glute. Yeah. So the only one that's contralateral is the opposite. So, and then once you're done with that, we're gonna have you go on the ridge of the skull and all the way across. You're just gonna rub. Okay. All the way, from the middle all the way to the ears.
But it's weird because this side is the one.
All right, hit a few breaths. What are you seeing? Room's a little brighter?
Yeah.
Yeah.
Oddly enough.
I know. I want you to
What the hell is that all
just
about?
walk. I want you just to walk and use your butt to push yourself forward. Keep breathing and let me know what you feel.
Butt to
Use your butt to push yourself forward. Keep breathing. Don't suck your stomach in. To where it's stronger, and then skips a big toe. Right. What do you feel?
Oddly enough, everything feels a little bit. I know we probably broke stuff down, but I feel like a little bit tighter in my core.
Are you trying to flex it?
I might be.
Don't
maybe
flex
that's
it.
why.
Yeah.
I'm not trying to, but I think just because like bracing myself, maybe that's what caused that. But otherwise, I mean, I feel pretty awesome right now. But
Is there a spot that your back always hurt in?
kind of where you were touching it earlier, just like my.
But I mean, is there a
lower
position
back.
or anything?
Oh, sorry. Shit, it's always hard to replicate. But like if I just normally right here, it would be.
Does it hurt now?
It's minimal.
Okay.
Yeah.
So we made it better?
Yeah, absolutely.
Okay.
Sometimes on a squat or a deadlift, right?
Setting up for a bench because like I'm kind of trying to get arched in there.
Yep.
That would kill me, and then laying down flat on my stomach or my back.
So let's lay down. Let me check your psoas and see if we get it even turned on more. Because a lot of times, Mark, in this situation with a psoas, if it's not activated and it can't flex the hip correctly, it locks down the back to protect itself.
Yeah,
So
like right, if I just relax,
does it hurt?
then it hurts.
Breathe. So a lot of times people that wear belts, this tissue gets stuck. So then if I just rub in here to release that, you feel that? So literally, because I was looking at a guy and I noticed that this belt, he stopped his breathing right at his belt line. His belt was gone. And the belt can sometimes hinder that tissue from developing. Because we should have a belly all the way down to the hip bone. And a lot of times people's hip bone, it's the belt that stops it. And then the other problem is a lot of women in our society, they suck their stomach in all the time. And that's why they have these back problems, because this tissue is always like that.
I do have female tendencies.
Okay. Hit a big breath. That's better. So you see how his belly opened up now? Even more. That's it right there. So it's okay if this moves after this fills up. Ready? Hold. Oh, did you feel that?
Just that I'm stronger? Or?
Yeah.
Yeah.
Yeah, you felt that?
Yeah.
That's a lot stronger. Okay. Keep breathing. Next, I want you to dig in your ribs along the edge. We're going to hit your quads. Right there, you feel that? Yep.
It's weird. Once I get my words together, during one of those deep breaths, my back actually popped.
Did it?
Yeah.
Okay, good.
It's wild.
All this stuff's starting to loosen up. If you can get this thing here to loosen up, this may not happen today, but I think over the next few days, things could start to change if he keeps breathing correctly.
Andrew, if you like lay back on your like bed and your knees are bent on the side of the bed, that probably hurts almost the worst, right?
It kills.
Like you can't let your back go, or you can't like sigh out air.
No,
almost like
no.
laying on a bench press, right?
Yeah, legs have to be elevated, or else I'm screwed. If I lay down on my right side, I'm destroyed. Oh.
And if your feet are like flat, then it bothers you less, right? Like if you bend your knees and your feet are flat when you're laying down, it bothers your back a lot less.
That's way chill. Yeah, that feels way better.
His calves are tight.
He can all of a sudden speak Spanish.
Oh, that one sucks. Don't do that one.
I want you to work on this jawline right there.
Okay.
So
it feels like when you haven't eaten all day and then you eat something sour and your like salivation glands are exploding. Man, that's wild. I never felt that on my jaw.
All
like
right.
from a.
Ready? Okay. You want to get up? Getting up was a little better.
Yeah.
All right.
Felt much
Walk
better.
a little bit. Now, when you walk, did you hear me explain walking? Squeeze your toe in the ground.
No, I didn't hear that part.
Okay, so I want you to step. When you step forward with this foot, grab that toe, squeeze as hard into the ground, and you use this butt muscle to push yourself forward. Ready? Push yourself forward. Yeah? Now step and go. Now just make it more natural.
It's really hard to be natural. Stop laughing at me.
Let me hit this arch. Feel how bad that is?
Yeah.
Come on, baby. Come here.
Oh, shit.
Here, the bash is open. All right, I'll see you later.
Oh, you gave me another back?
No, yesterday. I'll see you. Come on.
This is the part where you jump on his back, right?
There you go.
Oh, sick.
Oh, we're just going to work on your hamstrings a little bit. Get those spots. And the spots right around here, you say?
Oh, God. More like right here.
Okay. So this is, let me work on this a little bit. And then what we'll do is we'll lay you on the table and let you, I'm going to try to get this gap out of the way. A little bit bigger for you.
Will I get taller?
A little bit. So I'm trying to, so what happens is this is all gunked up. Right?
Yeah, my friend refers to it as your bass. It's your back and your ass all slammed together.
Yeah, like a gorilla ass, right?
Yeah.
So then what I do is I scoot him down here, so you're coming this way. And then I want to put your leg here. And I want this leg just to relax. And I want it to fall down. All right. And then, no, you should be good. So then this area right here, I'm trying to get it so that, so this leg, relax. Let this leg fall. That's all that's fallen. Do you see how tight it is? Yeah.
Yeah, that's as far as I go.
So what we can do is dig in there, and over the next 4 or 5 minutes, this area will stretch out because all that shit's compartmentalized, pressed up there. I'm gonna try to press this open. We're gonna come in here, just dig in that area. Yep, just that whole middle. All right, you feel that?
Mm-hmm.
Feel how tight that is?
Mm-hmm.
We gotta get that way loose.
Okay.
So flip over other side.
Stop them now.
That's right. By next, it won't take long, 2 weeks. Work on that area.
You guys won't even want to come in here.
Just trying to, I'm just basically stretching that area out.
That feels great.
Feels good? Yeah. I think this might be your problem. You can have a herniated disc and have no pain. I bet we have people in here with herniated discs with no pain.
Mm-hmm.
Yeah, there's plenty of people in here that don't know, right? That they have a herniated disc.
It's just all the other things that are happening causes the pain to appear. All right. Let's get up, take a walk. This will be really good for you.
Mm-hmm.
Where's that spot? Right here.
Right
Yeah.
here.
Look at both sides. I would say your hips are a little off too.
Mm-hmm.
You've been to Cairo lately?
No.
I would go to Cairo too. Keep RPR in Cairo so his hips are off.
Mm-hmm.
All right. So, any less pain? Bend over.
Yes, a lot less pain.
Okay.
For sure.
So, you need RPR every day. You need to do two things. You need to breathe and walk and RPR.
And then why, with the things that you've learned, why is this the first thing you go to rather than like exercises? Because we see people are like, oh, you need your back hurts, you need rehabilitation exercise. You have a different perspective.
With the RPR, I found that I get rid of the compensation patterns because sometimes the exercise may feel good for a little bit, but it's just driving home bad compensation patterns.
Right.
Depends on the exercise selection, right? So if I can get rid of the patterns and get you in the right pattern, and if you have pain, there's no way you're in the right pattern. There's no way. I've been able to find that people are more effective if I can RPR them first and then do those exercises. Right. That's the goal. Do whatever you think you need or whatever your physical therapist thinks optimal. Mm-hmm. They're probably right. It's just they didn't get rid of the compensation patterns before they have you started.
Got it. Yeah, because the only thing I've been able to like really notice a huge difference is doing things like whether it be planks or even just like farmer carries. Mm-hmm. Like for whatever reason, it kind of activates the core, and I feel like that's what's been helping me the most as far as like just relieving some pain. But it's not curing anything. No. I'm not getting better.
Let's do a side plank right now.
Oh boy.
All right, put your arm up. You're squeezing your core. Squeeze your core.
Mm-hmm.
Ready? Hold. All right, feel how weak you are?
Yeah.
Now I want you to squeeze your glutes. So when you do planks, activate your glutes.
Got it.
Got it? Now, to make it even better, do a stagger stance. Squeeze your glute. Ready? Got it? The stagger stance, I do everything staggered if it's possible because it's a better feedback loop. All my exercises, it's a cross-crawl concept from when you were a baby, how babies develop their brain. Mm-hmm. So anything you can do in a stagger stance is more optimal than the bilateral stance. Yeah, perfect. You just hold that ball right there. Oh, you're already better than you were before. You feel it?
That feels so good.
There we go. Oh, look at that.
Yeah, it'll drop down.
Because it was stuck up here before. Yeah. I've had athletes that left me with 4 fingers, and due to, this is a classic story I tell, the team he went to braced their core, and that's basically all they did all year. That rib went from 4 fingers to completely tucked inside the hip bone. And then I texted him when he had this problem, your skating's bad. And he was like, well, maybe you come see me. 2 weeks later, he blew his disc out. Because this whole stuff, everything became so compressed. All right. I think if you just keep working on this, I think things will get better. Don't know if they'll go away, but they'll get better.
Yeah, absolutely.
All right?
Any help would be.
Yeah. Well, we're going to.
Thank you so much.
Yeah, absolutely. Absolutely.
All right, peeps. That's how we're fixing our back around here. That's Cal Dietz fixing up my boy Andrew. Strength is never weakness, weakness is never strength. Catch y'all later.